My research experience at the Faculty of Medicine in the University of São Paulo has been nothing short of incredible. After completing my junior independent work, I had applied to be a Princeton Brazil Global Fellow with the intention of learning more about and investigating the exceedingly high rates of cesarean sections in Brazil. As an ecology and evolutionary biology major pursuing a certificate in global health and health policy, I became interested in studying the immunological effects of cesarean sections against natural vaginal birth on newborns within their first year of life. I gained access to and worked directly with a database that had information mined from maternal and newborn medical records, including variables such as the mother's age, the newborn's sex, date of birth, immunogram results, mode of delivery, gestational age, and birth weight. With this research, I hope to extrapolate my results into assessing past and developing new policy recommendations in order to provide further literature and better inform affected persons about the rate of cesarean sections in Brazil.
For my research, I focused on narrative medicine, a combination of the disciplines that I study at Princeton as a comparative literature major getting a certificate in global health and health policy. Specifically, I focused on lupus patient narratives, interviewing patients to learn more about their varied but shared lupus patient experiences and to gain insights that they give us on both Brazil's universal healthcare program and Brazilian culture in general. The research that I conducted in Brazil expanded on research from my second junior paper, where I analyzed Brazilian lupus blogs, noting common themes, structures, and tones that arose throughout the women's narratives. With my research conducted this summer, I had the chance to interview people in person to see how the medium through which a narrative is recorded influences the themes presented in the narrative. As an understudied illness both in the United States and Brazil that doesn't always present obvious signs of suffering, narratives provide a way for many lupus patients to share their seemingly silent struggles with lupus. They provide a voice for people who may feel as though they're ignored by society because of the lack of visible markers, and this allows for them to talk about topics that are important to them. Now that I study lupus patient narratives in Brazil, I hope to have the opportunity to continue to study them in the United States for the rest of my thesis research.
My research this summer focused on policies regulating the high rates of cesarean sections in Brazil. Brazil has one of the highest rates of cesarean sections in the world, with a rate of about 40% in public hospitals and upwards of 90% in the private hospitals. These rates are significantly higher than the WHO suggested rate of 15%, indicating that there are unnecessary cesareans that expose women and babies to harmful interventions. I analyzed the Birth in Brazil databank, which has over 1,000 variables regarding childbirth, such as the mother's socioeconomic status, race, education, prenatal consultations, and type of birth. During my time in São Paulo, I also interviewed various actors involved in childbirth: mothers, midwives, doulas, OBGYNs, policymakers, and activists, in order to collect the various perspectives on the cesarean epidemic in Brazil. For my senior thesis, I will combine this quantitative and qualitative data to elucidate the drivers of the high rate of cesarean sections in Brazil and the policy recommendations to address it.
Pela avenida toda iluminada, amanhã os blocos vão passar e o meu amor vai desfilar. Só vendo meu amor sorrindo, ganhando aplausos da multidão.